Imagine waking up in the middle of the night, your jaw throbbing in pain. Sounds familiar? That's a toothache for you. Toothache, a common yet often underestimated condition, can significantly impact your daily life. It can disrupt the most fundamental activities we often take for granted. Eating, for instance, becomes a painstaking task. Every bite, every chew can send a jolt of pain through your jaw, turning a usually enjoyable act into a dreaded ordeal. The variety of food you can eat diminishes as you start avoiding anything too hard, too cold, or too hot. Nutrition suffers as you compromise your diet. Sleep, that blissful escape from the day's toil, can also be stolen away by the relentless throbbing of a toothache. The pain can jerk you awake from the deepest of slumbers, leaving you tossing and turning, yearning for relief. The lack of sleep can lead to fatigue and a decrease in overall well-being. And let's not forget the impact on your work. Concentration wavers when you're constantly distracted by discomfort. Productivity dips, tasks pile up, and stress levels spike. Toothache isn't just a physical ailment. It's a formidable foe that can challenge your mental fortitude. The psychological effects of toothache are often overlooked but are just as crippling. The constant pain can lead to stress and irritability, casting a shadow over your interactions with others. It can affect your mood, making you less patient, less focused, and less present in your daily life. The discomfort can cause anxiety, as you worry about when the next wave of pain will hit. Imagine a symphony, a beautiful piece of music, disrupted by a single discordant note. That's what toothache does to your life. It introduces a note of discomfort that throws everything else off balance. It's a ripple effect where one small issue can lead to a cascade of problems affecting various aspects of your life. Toothache is no small matter. It can throw a wrench in your daily life, but don't worry, there are solutions. Before we dive into the cure, it's important to understand what causes a toothache. Toothache, that throbbing pain that can range from a mild annoyance to a severe distraction, can be caused by a variety of factors. For starters, tooth decay is a common culprit. This occurs when the hard outer layer of your teeth, known as enamel, is damaged. Bacteria in your mouth consume the sugars from the food you eat, producing acids that erode this enamel. Over time, this can lead to cavities or small holes in the teeth, which expose the sensitive inner layers, causing pain. Next up is gum disease, also known as periodontal disease. In its early stages, gum disease can cause inflammation and bleeding gums. But if left untreated, it can progress and lead to gum recession, exposing the roots of your teeth. These roots are not protected by enamel, and their exposure can lead to increased sensitivity and pain. Tooth trauma, such as a chipped or broken tooth, can also lead to toothache. This can expose the sensitive inner layers of the tooth or even the root, leading to discomfort and pain. Accidents, sports injuries, or even biting down on a hard piece of food can cause such trauma. Even issues not directly related to your teeth can cause toothache. For example, sinus infections can cause pressure in the facial region, leading to tooth pain. Similarly, issues with the jaw or temporomandibular joint can also result in a toothache. Now, understanding these causes highlights the importance of regular dental checkups. Dental professionals can identify early signs of tooth decay, gum disease, or other issues before they progress and lead to pain. Moreover, they can provide guidance on proper oral hygiene practices to prevent these issues from occurring in the first place. In conclusion, there's no one-size-fits-all cause to toothache. It can be instigated by a variety of factors, from tooth decay and gum disease to tooth trauma and more. Knowing the cause is half the battle. Now on to the cure. And now, the moment you've been waiting for. How to cure a toothache. Let's dive right in and explore some manageable steps you can take from the comfort of your own home. Step 1. Rinse your mouth with warm salt water. Salt is a natural disinfectant, and it can help to loosen food particles and debris that may be stuck in your teeth. This can provide temporary relief from discomfort. Simply dissolve half a teaspoon of salt in 8 ounces of warm water and swish it around your mouth for about 30 seconds before spitting it out. Step 2. Apply a cold pack to the affected area. Cold can help to numb the area and reduce swelling and inflammation. Wrap a bag of ice or a cold pack in a thin cloth and apply it to the aching tooth or your cheek for about 15 minutes. Step 3. Reach for over-the-counter pain relievers. Non-prescription medications such as ibuprofen can be effective in relieving toothache pain. Remember to always follow the manufacturer's instructions and never exceed the recommended dosage. Step 4. Use a topical oral anesthetic. These are available at most drugstores and can provide temporary relief. They usually contain benzocaine and can numb the area for a short period of time. Step 5. Try a natural remedy like clove oil. This essential oil has been used for centuries to relieve toothache pain, thanks to its natural anesthetic and antibacterial properties. Just dab a small amount of clove oil on a cotton ball and apply it to the sore area. Now, while these steps can provide temporary relief, they are not a substitute for professional dental care. If your toothache persists for more than a couple of days, if it is severe, or if it is accompanied by other symptoms such as fever, earache, or pain when you open your mouth wide, it's time to seek professional help. A persistent toothache can be a sign of a more serious issue, such as an abscess or an infection that could spread to other parts of your body if left untreated. Your dentist can identify the cause of your toothache and provide appropriate treatment. This may include a filling, a root canal, or even an extraction, depending on the severity and nature of the problem. In the meantime, while you're waiting for your dental appointment, continue with the steps we've outlined. They can help to keep your pain at a manageable level and prevent any potential infection from spreading. So there you have it, a step-by-step guide to ease your toothache. But remember, these are temporary solutions. A visit to your dentist is the most reliable way to address a toothache and to prevent future dental issues. So don't delay in getting the professional help you need. After all, your smile is worth it. Temporary relief is good, but wouldn't you want a permanent solution? Now let's dive into how we can achieve that. First and foremost, regular dental checkups are a must. Just like how we maintain our cars with routine service, our teeth also need regular professional care. These checkups can detect potential issues early, before they escalate into painful problems. So don't wait until you're in pain to visit your dentist. Make it a habit to see them every 6 months. Next, maintaining oral hygiene is essential. Brushing twice a day, flossing daily, and using mouthwash can keep your teeth and gums healthy. Remember, a clean mouth is a happy mouth. And don't forget about the tongue. It harbors bacteria too, so give it a good scrape when you're brushing. But it doesn't stop with brushing and flossing. The health of our teeth is also largely dependent on our diet. Consuming too much sugar can lead to tooth decay, one of the main causes of toothache. So try to limit your intake of sugary drinks and snacks. Instead, opt for a balanced diet rich in fruits, vegetables, and dairy products, which provide essential nutrients for strong and healthy teeth. Furthermore, consider lifestyle changes that could benefit your oral health. If you smoke, try to quit. Tobacco not only stains your teeth, but also increases your risk of gum disease and oral cancer. Regular exercise, on the other hand, can boost your overall health and indirectly contribute to good oral health. Lastly, if you're dealing with persistent toothache, seek professional treatment. Sometimes toothache can be a symptom of an underlying condition that requires medical attention. Ignoring this pain could lead to more serious complications in the future. In conclusion, a permanent solution to toothache involves a combination of regular dental checkups, good oral hygiene practices, a healthy diet, and lifestyle changes. By adopting these measures, you can keep toothache at bay and enjoy a pain-free life. Let's quickly recap what we've learned today. Toothache, a seemingly minor inconvenience, can significantly impact your daily life, disrupting everything from your ability to enjoy food to your sleep quality. Understanding the root cause of toothache, which could range from cavities to gum disease, is the first step towards finding a cure. We walked through a step-by-step guide to alleviate toothache, emphasizing the importance of prompt action and professional help. Remember, temporary relief is just that, temporary. For a permanent solution, we discussed various options like regular dental checkups, maintaining good oral hygiene, and adopting a tooth-friendly diet. In conclusion, toothache is not something to be taken lightly. It's a sign that your oral health needs attention. By taking the right measures, you can not only cure existing toothache, but also prevent future occurrences. Remember, your oral health is in your hands. Take charge and say goodbye to toothache forever.